Good Neighbor Pharmacy side, the way that we've been thinking about this, so just to share a little bit about who these independent pharmacies are, they're typically in highly rural or underserved urban markets. You're not going to see a lot of them in the suburbs. That's just not where they play. And they're also highly indexed in government-paid patients, right? So a high propensity for Part D and a high propensity for state Medicaid reimbursed patients. So they're very uniquely positioned, I think, and as I think about today in the conversations, how we can plug in to some of the larger scale initiatives that we're talking about up here. Some of the things that we're doing within Good Neighbor Pharmacy, and when I look back at the COVID vaccine efforts, and Anita, you're in the room, so this is cool. Anita took a chance on us as the independents. In the early conversations, the conversations where we don't have enough licenses for 22,000 independent pharmacies to be able to order through VTRAX and Tiberius and whatnot. And we said, hey, we know we can reach these highly socially vulnerable patients in rural America, as well as in some of the urban markets. Let us contract on behalf of our independents, and something we hadn't ever done before. And it was really special. And I think we've proven, as the entire pharmacy profession has, how important their reach is, the high level of care that they take of their patients. And with these independent pharmacies, what's unique is we've had health plans call us and say, gosh, you're taking care of the sickest patients. You're costing us the most amount of money. And we say, yeah, independent pharmacies take care of really, really complex patients. And they're typically, again, highly indexed in Part D. So they tend to have more, more comorbidities, et cetera. So when we think about how we can help with that from a GNP perspective, some of the things that we're doing are providing data. Our pharmacies they don't have a back office, right? They don't have people working with them on marketing and understanding what their market is. So something that we provide for these independents is understanding what their community looks like. What are the demographics? Who's in their community? They know who's walking into their store, but what they don't know is maybe who isn't, and understanding why. Do they need to adjust their services, their product selection, things like that, so that they make sure that they reach them. And we have story after story of our independent pharmacies throughout this COVID effort and the vaccine efforts going out into their communities, going out into homeless shelters, LGBTQ homes, just really, really cool stories, which I know everybody did. But they really are highly accessible in terms of where they're located, but also the high level of care that they provide. And then the other thing that we've recently expanded upon is providing marketing and advertising support. So digital, of course, Facebook, Google paid advertising. But also when you think about these elderly patients, they're not always excited about having to book an appointment through their smart device, right? They need a little bit more hands-on. So just outbound calling, outreach into their communities. When they walk in saying, let's schedule your vaccine appointment right now. Let's get you tested right now. You're here, we can help you. Or independent pharmacies have also been delivering since the beginning of time, and they do it for free, for better or worse. That's a whole other conversation. But they do, and they have forever. And they're out in these homes. So when COVID happened, they were delivering groceries. They were doing blood pressure screenings. And I think we need to think about how we can leverage all of our resources to meet these patients where they're at, instead of waiting for them to find us. We wholeheartedly believe that we need a permanent, beyond the PrEP Act, a permanent and consistent reimbursement model for pharmacy. This is about the profession, regardless of where you're located and what your pharmacy looks like. The other thing, as I think about the independent space, we have a wonderful story to tell. Each of the, our panelists have a wonderful story to tell about the care that their pharmacists are providing to their communities. And I think for the independents, it's a little harder. We have many different pharmacy systems, and we're trying to pull that data together, and that is an initiative for us to be able to tell that story on behalf of our independents, and not only ours, but those that are not part of the Good Neighbor Pharmacy program, which is another 10,000 pharmacies, right? We have to work together as a group to advocate, educate, and help the communities and patients, and I think certainly government, understand the value that we bring. And at Good Neighbor Pharmacy, one of the kind of mottos that we've kept front of mind is that a better represented and culturally understood patient has a better chance of successful outcomes, healthcare outcomes, right? So something that we recently launched and founded is a scholarship for Black and African American students who want to pursue a pharmacy degree at historically Black universities and colleges. And because we believe, when you look at the makeup of pharmacists, there's a lot of diversity, but in pharmacy ownership, because we're trying to cultivate a future of pharmacy owners, less than 22% are considered non-white, and less than 5 are Black or African American. So I think we have a wonderful opportunity to build upon that, not only with what we're doing. What we're doing is small, but it's a start as we think about the future and making sure that patients are culturally understood and represented within this pharmacy base that we represent. When I think about challenges, I think about, for instance, I'll just share an example. We have a pharmacy in Sacramento who's getting monkeypox vaccine. They've given over 60% of the vaccine through a partnership with the public health department to the patients that are in need in Sacramento, and they have been reimbursed 0, right? So I think when you think about the financial model and how important that is, I kind of wish we could have merged the payer meeting that you're supposed to be at with this meeting, because I think the two are really, it's important that we're talking to that also important stakeholder. But I think, when you think about that financial model, we know they're reaching they're going out to social clubs, they're going out to group homes, and they are making sure that patients in Sacramento are covered in terms of monkeypox. So I think that's happening everywhere in pockets, but having that long-term permanent financial recognition of the benefits and the care that they're taking for their communities is really, really important. And then I think to compound that, there's a statistic that came out of NCPA that for independent pharmacies, 68% of them could not fill a position in 2021 that they needed in their pharmacy. And I'm sure it's probably the same for all of us up here. They're trying to hire in highly rural markets. There isn't a big pool, right? That probably may make it a little worse for them. But trying to do what our pharmacy in Sacramento is doing with less people is just not sustainable. So I think as we think about where we go from here, the partnerships, when I think about partnerships, it's everybody in this room together telling that story of that care and of the impact that our pharmacies are having. And that's how we're going to be successful in moving the needle.